Pressure continues to grow around Health and Human Services Secretary RFK Jr. In a New York Times guest essay, 9 former CDC directors penned a scathing piece calling him dangerous, added his leadership is, quote, unlike anything our country has ever experienced. Joining us to discuss the fallout today, Raymond James healthcare policy analyst Chris Meekins, also a former HHS Deputy Assistant Secretary. Chris, thanks for the time. Good to see you.
Thanks for having me.
We did hear Stephen Miller just last week call RFK Jr. a crown jewel of this administration. Do you really think he's in any kind of political jeopardy?
Well, Stephen Miller previously called him some really ugly things during the campaign trail, but magically when you endorse the president, all things can become possible. Look, when we look at the space and we talk to investors and we talk to people here in D.C., what's becoming increasingly clear to us is the president has a political reason to keep RFK around until after the midterm elections. He is absolutely laser focused on trying to make sure the House stays Republican so he doesn't get impeached again. You see his actions leaning in on redistricting and gerrymandering in Texas and other Republican states to try to maximize the number of Republican seats to try to hold on to his evidence of that. So we think RFK is likely, as our base case, safe until after the midterm elections, with the caveat being that there is a point in which the political cost of keeping him could outweigh the political benefits, the political benefits of keeping him are outweighed by the cost of some of his actions with really swing voters.
Right. Do you think those costs involve actual policy, or is it more about rotating headcount, mean op-eds in the Times?
Yeah, I don't think mean op-eds in the Times are going to determine the midterm election outcomes for House Republicans in the key states we're watching across the country. What I will say, however, is that some of the actions we'll be seeing around the autism report later this month or around changing the vaccine schedule, there are obviously some people that are skeptical of vaccines, but for the vast majority of the American public, making a big change that could result in their children not getting the vaccines they need could be politically problematic going forward.
You know, a lot of the weakness in the sector gets blamed on him and some of the changing policy, but I wonder how much is deserving of that. If you look at the worst performers, Centene, United Healthcare, I mean, aren't there other bigger problems happening in the insurance business?
Yeah, no question. The insurance space has been incredibly complicated. Centene, a lot of that's related to Medicaid redeterminations that were ending after the COVID emergency, as well as changes in the OB3 reconciliation bill that was passed that will cut Medicaid, as well as potential concerns over the future of the Affordable Care Act expanded subsidies. I think when we look at RFK, the concern really is in the pharmaceutical space. So when you look at whether it's the COVID vaccine makers like Moderna, you look at players like Merck and GSK, as we potentially will see changes to the vaccine schedule. You know, I think one of the most important things to watch really is this autism report. There's a man named David Greer in charge of it who's a vaccine skeptic. It'd be kind of the equivalent of putting the Cookie Monster in charge of dietary guidelines. We all know what the outcome's going to be. We know it's probably going to be unhealthy and unscientific, but we still have to navigate that for investors as they figure out what they could try to pin autism related to and what the impact on publicly traded names could be.
It's going to get interesting, obviously, going into flu season, a time where we sort of, on schedule, start paying more attention to health policy, certainly. Chris, hope to have you back soon. Thanks for that.